So patients that get treated for asthma have a couple different options for different medications, and they're typically going to fall under two different categories. So there's control medications or rescue medications. The control drugs are going to prevent asthma attacks and reduce the inflammation that comes along with having asthma, whereas the rescue drugs are going to help relieve the asthma attacks. And this is going to be on the onset of having an asthma attack. A patient can take something like a rescue inhaler and almost immediately is going to help to reduce the symptoms that they might encounter, help to open their airways, where once again the control drugs taken more long-term, taken on a daily basis. Things like Advair is a common brand name for an inhaled steroid that's taken daily. Or you may have heard of something like montelukast or Singulair if you work in medication administration, and that's going to be your pill form of a controlled drug, and it's a leukotriene modifier. But there's also things like long-acting beta agonists or theophylline, and these can also be coupled together for add-on therapy, and I'll talk more about that a little bit later. And then there's also different rescue drugs, something like short-acting beta agonists or epinephrine. So you may have heard of an EpiPen, that's going to be your epinephrine. Something like albuterol is also a rescue drug. And what a patient gets prescribed is largely going to depend on things like how old they are or what their previous health history is, how severe their asthma is, what type of asthma they have in general, and if they're taking other drugs, what type of drug interactions there may be. So the most common or the most effective treatment is going to be the inhaled corticosteroids. And this was found by a study done in 2010. And this drug has a mechanism of action of inhibition of expression of inflammatory genes. So on the left side of that chart there, you see all these different cells, and these are inflammatory cells. So your eosinophils, your T lymphocytes, mast cells, dendritic cells, those are all going to be increased in things like asthma and cause more inflammation. But the corticosteroids are going to help bring that number back down. And then it's also going to help the integrity of the cells that are typically going to get damaged in asthma. So it's going to help the epithelial cells, the endothelial cells, airway smooth muscles, and the muscle glands. And with this drug, with any drug, you're going to have some side effects. But with this specific one, it was most common for people to have a hoarse voice since it is an inhaled drug, or something like oral thrush, and then you can also encounter things like increased infections. You might see an increase in tuberculosis or pneumonia. There was, however, found to be corticosteroid resistance, specifically in people that have things like chronic obstructive pulmonary disease or asthmatics who smoke or people with severe asthma. So why is this happening? You have to remember that the whole point of asthma is that there is these pro-inflammatory transcription factors that have this intrinsic capability, enzyme capability of histone acetylation. And you don't really want that because that's going to cause chromatin to open up and allow for the propagation of the transcription of these inflammatory genes. And so corticosteroids act in binding to this GR receptor. And in people with mild asthma, it's going to work normally, and it's going to upregulate HDAC2, which is an enzyme that decreases histone acetylation. So overall, it's going to inhibit the inflammatory cells. But in people with something like COPD, they also have the addition of oxidative stress and nitrative stress from things like smoke. And so that's going to present itself in forms like peroxynitrite, and that's going to cause the inhibition of the HDAC2. So it never gets the chance to act on the inflammatory genes. And so that's how resistance is caused. But also, once you have other drugs added on top of it, and it's coupled to things like theophylline, it can actually be effective. So there are various support groups, and I actually didn't know this, but there is an Asthma and Allergy Foundation of America, and they have emotional support groups across all the different states. In Pennsylvania, there's 2 emotional support groups, and they host informational events, and they actually accept donations too. So if you are interested in donating, that is an option. maybe you have asthma or you know somebody who has asthma, and they have this thing right now where if you donate $75 or more, you get a free face mask. So if you're super interested in that, that is always an option. Here's a list of our references, and that concludes our presentation. Thank you.